Gynecology. The female reproductive system. Womb, ovary, neck of womb or cervix, fallopian tube or salpinx, and vagina. B. Menstruation. A period is the common name for a menstrual period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's note LMP to 5 to 52 ago means the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually written in the form 28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss, menorrhagia, often with the passage of clots, coagulate blood. The term period pains means dysmenorrhea or painful menstruation. The time when a woman stops menstruating, normally at about the age of 50, is called the menopause or climacteric. In everyday English, it is known as the change of life or simply the change. Symptoms of the menopause include hot flushes, sudden sensation of head at night sweats, a gynecological consultation. A gynecologist is talking to a 30-year-old woman. Gynecologist and patient. Are your periods regular? Yes. How often do you get them? Every 4 weeks. How old were you when you started to get them? About 12. When was your last period? A week ago. How long do the periods last usually? 4 or 5 days. Would you say they are light or heavy? Light. Do you get clots? No. Do you get period pains? Not really. Is there any discharge between the periods? A little. What color is it? White. Contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, known as the pill, the diaphragm, and the intrauterine device, or copper cord. Condoms are available for both men and women. Ginecología. El sistema reproductivo femenino. Útero, ovario, cuello del útero o cervix, vagina, trompa de falopio o salpinge. Menstruación. El periodo es el nombre común para una menstruación. El inicio de la menstruación se llama menarquía. El último periodo menstrual se abreva comúnmente en las notas médicas como LMP. Una paciente dice que su último periodo menstrual fue hace 2 semanas. El ciclo menstrual o ciclo es el tiempo entre el inicio del periodo y el inicio del siguiente. Las notas pueden usar la forma 428, lo que significa que la menstruación dura 4 días y ocurre cada 28 días. Si un periodo dura más de 5 días, o si la pérdida de sangre es excesiva o pesada, se llama menorragia. A menudo, con el paso de coágulos, sangre coagulada, la cantidad de sangre menstrual se puede estimar en toallas sanitarias o tampones. El momento en que una mujer deja de menstruar, normalmente alrededor de los 50 años, se llama menopausia. El periodo de tiempo inmediatamente anterior y posterior a esto se llama el cambio. Y los síntomas de la menopausia incluyen sofocos, sensación repentina de calor, irritabilidad, mal humor, sobre las glándulas. Consulta ginecológica. Un ginecólogo está hablando con una paciente de 30 años. ¿Sus periodos son regulares? Sí. ¿Qué edad tenía cuando llegó el primero? 12 años. ¿Con qué frecuencia tiene su periodo? Cada 4 semanas. ¿Cuánto duró el último? Alrededor de 5 días. ¿Cuánto duran sus periodos normalmente? 4 o 5 días. ¿Son ligeros o pesados? Bastante ligeros. ¿Expulsa coágulos? No. ¿Tiene periodos dolorosos? No realmente. ¿Hay alguna secreción entre los periodos? Un poco. ¿De qué color es? Blanca. Anticoncepción. Los métodos utilizados para prevenir el embarazo incluyen la píldora anticonceptiva oral, el diafragma, el dispositivo intrauterino, DIU, o el anillo de cobre. Los condones están disponibles para mujeres y hombres. Write a simple English phrase for each of the medical terms. Hysterectomy, remove of the womb. Menorrhagia, heavy periods. Salpingitis, inflammation of the tubes that connects ovary to womb. Cervical biopsy, biopsy of a small piece from the neck of the womb. Read the conversation between the gynecologist and the patient. Menarche, 12 years. Menstrual cycle, 4 5 28. LMP, 152 ago. Menorrhagia, no. Dysmenorrhea, no. Discharge, a little will discharge in between periods. Now write the question that the doctor asked. Marriage. How old were you when you start to get them your periods? Menstrual cycle. Are your periods regular? LMP. When was your last period? Menorrhagia. Would you still have light or heavy? Menorrhagia. Dysmenorrhea. Do you get period pains? Discharge. Is there any discharge between periods? Complete the case report. A 45 years old woman had been having prolonged periods lasting for 8 days with the passage of clothes for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot pulses or night sweats, and her general health had always been good. She had taken the oral contractive pill until a year previously when a couple call was defeated. She had had a normal pregnancy when she was 25.